Howdy, howdy. How are you? I can't hear you.
Hello.
Okay.
I'm
Hi.
Kim McCarl. I don't think we've had a chance to meet.
I have not met. I'm Palo Walker.
Nice to meet you.
Nice to meet you. I'm trying to figure out how to rename this thing, but it might be beyond my infantile eye-tech capacity. I can't hear you.
Hello.
Hey, Kim.
I'm
Hi.
Kim McCarl. I don't think we've had a chance to meet.
I have not met. I'm Palo Walker.
Whoops.
Nice
Hang
to
on a
meet
minute.
you.
Nice to meet
Going
you.
on here. Bear with me. I got something freaky
I'm
happening.
trying to figure out how to rename this thing, but it might be beyond my
Hang on.
infantile eye-tech capacity. I can't hear you.
Hello.
Oh dear. Hey, Kim.
I'm Kim
join
McCarl.
us?
I don't think we've had a chance to meet.
Hang on.
I have not met. I'm Palo Walker.
Whoops.
Nice
Hang
to
on a
meet
minute.
you.
Nice to meet you.
Going on here. Bear with me. I got something freaky
I'm
happening.
trying to figure out how to rename
You guys
this
hear
thing,
me?
but it might be beyond my
Hang on.
infantile eye-tech capacity. I can't hear you.
Here.
Hello.
Hey, Kim.
I'm Kim
join
McCarl. I
us?
don't think we've had a chance to meet.
I have not met. I'm Palo Walker.
Whoops.
Nice
Hang
to
on a
meet
minute.
you.
Nice to meet you.
Going on here. Bear with me. I got something freaky
I'm
happening.
trying to figure out how to rename
You guys
this
hear
thing,
me?
but it might be beyond my
Can you guys hear me?
infantile eye-tech capacity. I can't hear you.
Here.
Hello.
Are you guys able to hear
I'm
me?
Kim McCarl. I don't think we've had a chance
Can
to
you
meet.
hear me, Colleen?
Here. I knew that was
I'm
happening.
Palo
I
Walker.
how to do that.
Nice
Hang
to
on a
meet
minute.
you.
Nice to meet you.
Oh my God. With me.
Yeah, Colleen, can you hear me?
Figure out how to fix this. I can't hear them at all.
Okay, now we can hear you, Colleen. I think we have resolved it. Tom, can you hear us?
Kim, can you
Yes, I
figure
can.
out how to?
Excellent.
Hi guys. Something is happening here. Hang on.
I think we fixed it. I think we're good.
Are we good now?
I think we are.
I can hear you.
I can hear you. Sue, we can't hear you, but that's because you're on mute, so that doesn't count.
Did we solve the problem? I was sitting here trying to figure out how to solve it.
I think we did.
I don't think you can hear me now because it's showing that
Now
I'm
we
mute.
can.
I
Now
can hear
Oh,
you.
you
Kim.
can?
Mhm.
Okay, interesting. My
think
computer signal is a little backwards, I think.
Okay, so we're going to go ahead. So we're going to go ahead and we're going to. It's still echoing.
Yeah, I don't hear you real loud, Colleen.
Oh dear.
We can hear you. I got you.
Something's going on here. Hang on, people. I'm very sorry if anybody can hear me, but we're having a problem here with the system. Kim,
Can hear you.
okay.
Can you hear me,
so-
Colleen?
Yes, I can hear you.
Great.
So somehow or another, when I went live to YouTube, it's like repeating constantly.
Yeah,
But I think it's resolved now. I mean, it was going sort of looping around for a minute there, but
Not resolved. Not resolved.
are you still seeing it?
YouTube is still hearing repeats.
Oh.
So I'm trying to find, hang on, I'm on live stream. And I'm still hearing repeats here too on Zoom. So I'm trying to find out what's going on.
Do you want to stop recording and try doing that again?
I think what I'm going to do is I'm going to switch to my phone audio.
Can you guys hear my husband's football game in the background?
No.
I told him he can't scream crazy things at the screen, though.
Is Sarah on YouTube, Colleen?
Yes.
But we probably don't want to go ahead until YouTube gets resolved, or people are going to miss out.
Hang on. Okay, can you guys hear me now?
Mhm.
Are you guys okay?
Yep.
I'm not hearing repeating anymore. Hallelujah. Oh, now I'm hearing repeating again.
Oh, no.
Okay, so hang on a minute. I really apologize, everyone, for if you're having problems, but we will get started.
Okay, can you guys hear me?
Yes.
Yeah.
Oh, good. I think it was my computer. So, hello, everybody. I think we're finally going to get started here. So I do appreciate everything that you guys were doing waiting to get back on here. I know we got a lot of people on YouTube, and I think that's wonderful. So we do have a lot of people there on YouTube. So hello, everyone. My name is Colleen Garrity, and can you guys hear me? Am going to go ahead and get started here. I think it was my computer. So, hello, everybody. I think we're finally going to get started. So let's go ahead and get ourselves moving here. You can always check out danaestates.org and see what's going on with Dana Estates. So today we do got a lot for you that's going to be hopefully wonderful for you. But before I get started on that, I'd like to go ahead and let you know who your 2021 board is. Can you believe 2021? I can't. Can't believe we're in 2021 already. Anyway, Colleen Garrity, I'm your Dana Chair. We got Sue Fulmore here. She is our secretary as well as our Area 4 rep. Sue, are you on here to say hi?
Yes, I am, Colleen. Hi. Hello, everybody. Nice to be with you tonight.
Great. And then Penny Dorfman, who's on YouTube, is our treasurer. We got a new board member, Angela Cantrell. She's our Area 1 rep, new, and welcome to her. And I'm so excited she's on board. Angela, are you online?
Hi,
she's
yes,
here.
I am.
Hi, Angela.
Hi, everyone.
And then we got Pello Walker. He's back again. I'm so glad. It's our Area 2 rep. And Pello, are you here? I think you are.
I am here. Can you hear me?
Yes, we can.
I'm here.
Then, of course, hi, Pello.
Hi.
And then
Happy New Year.
Happy New Year to you, too. And then we've got Kim McCarl. And Kim, I am real excited, is our Area 3 rep. And Kim, and also, by the way, I think she's going to be doing a lot of putting up signs and stuff like that, too. But Kim, are you here?
I am. Hello, everybody.
And then, of course, we do have an opening, Area 5, so we need people. So let me talk a little bit about that. We do need people. Like I said, Sue is doing Area 4 as well as being secretary. And so we would love if anybody out there, especially men, we only got one wonderful man on the board right now. We need area reps. So we need an Area 4 and an Area 5 rep. So if you have a call to duty to maybe help out in the neighborhood, plan some wonderful events, maybe help me with Zoom because sometimes I have trouble with it, as you can see, definitely please join the board. And of course, we always can use people to deliver newsletters, help with dumpsters, help with the garage sale. Yes, it will be this year. We are going to have one this year, the Dana Night Out, and anything that you might want to do to help out in the neighborhood, come with great ideas to help keep us strong and together. Definitely reach out to chair@danaestates.org and just let me know. We'd be more than happy to have you guys on the board. Believe me, we really need people. I know it's difficult because we lost 5 board members. 4 of them moved out of the neighborhood, and 1 of them is working 3 jobs. So we lost 5 people, and I need to replace them. So please, we need people to keep us strong. But I tell you, the people we have on the board right now, they're going to be strong. Definitely. So tonight, we are going to have some wonderful people speaking. Dr. Tom Warren from Contra Costa Health Services and Laura Hoffmeister, our city council member, will be on a little later. Dr. Tom Warren is going to be first speaking. So please, if you have any questions, you can type them in on YouTube. If you are on YouTube, because I know we got a lot of people on YouTube right now, you can type them in on YouTube. And just let everybody know, hey, this is my question. If you happen to be on the Zoom meeting, by all means, you can just go ahead and just raise your hand or put your thumbs up, and we'll be able to ask those questions to either Dr. Tom Warren, Laura Hoffmeister, or if you have a question for the Dana board, by all means, you can ask us as well. So I'm going to go ahead and start with Dr. Tom Warren. So let me go ahead and stop sharing my screen so we can get started with that. So bear with me here.
While Colleen is doing that, I'll just chime in and start by saying, can you hear me?
Yes.
Okay.
Yes, we can.
Great. Thank you all for inviting me to come and speak tonight about coronavirus. It's a really super important topic for all of us, and happy I'm able to come and hopefully share some useful information. In terms of disclosure, Kim and I work together.
Great.
And we do.
Yeah, and Kim, were you going to be able to share
Yep.
screens on the? We're going to go to our county dashboard and talk through some things. Just before I start, let me just say what I'm going to be talking about. I want to kind of give you an overview of what's going on currently with coronavirus in the area and the county, and what our response, the county's response, and the healthcare system's response is to it, and kind of our key messages we hope people are hearing and able to follow. You know, I think right now, and I'm going to talk a little bit about the current data, where we're at with things and what that means. And then I'm going to spend a bit of time going through some important points around vaccines. So I think, you know, right now, the key stories are, you know, it's kind of good and bad. I mean, on the really good news side is that we have this vaccine coming out, and you know, it's faster than expected. It appears to be very safe, and it actually appears to be a lot more effective than we could have even hoped. So you know, we've really, one of the really bright stories, the bright spots in the whole saga here in the United States has been how fast we've been able to get these vaccines developed, and we're starting to get them rolled out. So that's the really good news. The other main story, though, is that we are in a very, very serious surge right now, and coronavirus is actually worse than it's been, you know, throughout this whole period. We entered into a worsening trend. We had, I'll show you on the chart here in just a second, but we had a surge in the summer, which we were able to kind of tamp down, flatten the curve through reimposing kind of more statewide stay-at-home restrictions and kind of closing down the opening at that point. And we were able to do pretty good for quite a while the rest of the country started to kind of rage and go really in a bad direction. In the late summer, early fall, we were still in an improving trend, but since late October into November and December, we've seen increasing numbers. I think you all know that the situation in Southern California and Central California in particular is really pretty dire. We're fortunate that we're not quite in that bad of a situation here, but it's a very serious thing. So we all need to know that, and the third major point, the two main stories, vaccines and the worsening surge, the main point that I would like to drive home is that this is still a really, really serious situation. And now more than ever, it's really important that we take care of ourselves, we take care of our families, we take care of our elders, we take care of our communities by doing the right things we need to do, by avoiding social gatherings we don't need to do, by practicing social distancing, by wearing masks when we're out of the house and we're with people outside of our own household, and getting testing and seeking care if we're sick. These are all really super important now more than ever. Let's go through the current numbers. On Kim's projecting the screen from our county dashboard, I invite you all to look at the address up at the top. It's coronavirus.cchealth.org, and it's a really, really fantastic website. And I've got to give Kim tremendous kudos and credit for being a driving force behind it. We really have some great information there, as well as really great current data, so you can kind of see where we're at. I think if you're following the news and you're following what the state policy environment in terms of the current stay-at-home orders and so on, as well as the blueprint tiers that we have as well, and that kind of preceded this. There are a couple variables, a couple statistics that we look at most strongly in terms of how we're doing, and one is the cases per day per 100,000 people. So this is, Contra Costa has about 1.2 million people, so it would be taking that 1.2 million, dividing it, so it's the number of cases new per day per 100,000 people. That way it's an even measure that can be applied across all different counties or all different communities, normalizing it that to 100,000 numbers. So, and we actually look at a 7-day average. And so it's not just one day's data, it's an average of 7 days. And it's also 7 days in arrears, because it takes a few days for all the data for test results to come back from the labs and for them to all be numbers to all get in the system. So the most reliable numbers we have are from about 7 days ago, usually. And so it looks at that number and 7 days prior in terms of our average cases per day. Also the testing positivity rate. So that cases per day number is currently right around 50. And that's really high. I'll show you on a graph in a second, but we've been seeing increasing rates over the last 2.5 months. Going back to October, we were around 5. In mid-September, we were around 5, and then in mid-October around 10. Now around 50. So it's the world is 5 to 10 times more dangerous out there right now than it was back then. You got to keep that in mind in terms of the prevention messages and protecting yourself. Also, our test positivity rate is 10.7%. That's higher than we would like. It's better than a lot of other places in the state, but that shows that out of about one out of every 10 people that goes for testing right now is coming back positive. Kim, if you scroll down a little bit, we'll look at the graphs to show you the trends on these things. This graph right here is that first number of new cases per day per 100,000 residents, and you can see how we kind of peaked the early summer surge, and then we brought that down through policy actions and kind of like closing down the reopening activities, reinforcing the masking orders and those sorts of things. And we saw, people around here, we really took it seriously. And for the most part, in our county and in the Bay Area. And with that, we were able to bring it into control, while a lot of the other country was really, really going in the wrong direction. We were bringing it down the way we should. The fact is that factors throughout the country and throughout the rest of the state started to impose on this region as well. Southern California started to surge before we did, and then in late October, mid to late October, our numbers started going up as well. And you know, it's kind of a train that's rolling. We tried to do everything we can to slow it down, but we've seen increasing numbers, not as bad as the southern part of the state, but still very concerning. Again, our case numbers increasing by 5 to 10 times. We peaked in early. We actually, the state and the county reacted to this just after Thanksgiving. Of course, there was the post-Thanksgiving surge, and we tried to tamp that down by doing new stay-at-home orders, because we were, you know, we could tell that we were heading in the same direction as Southern California, right? So we did everything we could to try to protect everybody and bring it down, and it had some effect. We saw decreasing numbers through about Christmas time, but you know, the holidays are really tough. People are doing a lot of things, a lot of shopping, probably a lot of at least family time gatherings as well, and we now have a post-Christmas surge. We do expect as well to see an increasing bump or an increasing surge post New Year's time. The holidays are hard. People have a hard time staying at home. So we are still on an increasing trend, I would have to say. We're hoping that we're seeing it flattening, but it's concerning and it's serious, and you need to know that. So scroll down a little bit. This is our test positivity rate. Again, you know, we brought the numbers down after July really nicely, but then in this most recent 2 months, we've been increasing again. Right now, we're at around 10% test positivity. We also have the green curves and the blue curves, and what these are is reflecting the state's equity metric, and this is our county's equity metric as well, where we look not only at the test positivity for the community as a whole, the county as a whole, but also for the 25% of census tracts that have the lowest ranking are a Healthy Places Index. These are communities that tend to have more poverty and have a lot more challenges in terms of the social determinants of health that impact healthy communities, and those communities are seeing higher rates in terms of test positivity and in terms of coronavirus. We can continue to scroll down a little bit. Total number of cases in the county right now is about right around 48,000. And if we scroll down a little bit more, we see that our cases, actually the bar graph first, we can see that our new cases per day on a daily basis is up close to 1,000 right now. These gray bars right here are right in the range of close to 1,000, and right around New Year's it was around the same. It goes up and down by whether it was weekend or weekday, but overall, if we go down to the next graph, we can see this is our average number of new cases per day with a 7-day average. It's a little bit smoother way of looking at it. But again, we see the increased number of cases per day through mid-December brought it down a little bit with the new stay-at-home orders, but the momentum behind the holidays is just tough to beat, and it's going back up again. Scroll down a little bit more. I think the number I'd like to go to next, actually, if you could just take us down to the death statistic, we can see how many. Oh, actually, sorry. Can we stop right there first? This graph right here, and it's going to be a little hard to see the whole thing, shows, and Kim, if I can just double check, this is the number of cases, right? Yeah, the cases per. So we see, it's important data for people to see within the county website. We have by municipality community what the case numbers are, and this is a little bit different number. It's the last 14 days count per 100,000. You know, our most severely impacted communities have been places like Bay Point and San Pablo, 1,600, El Sobrante, Richmond, they're all right around 900, Antioch. But I think that Concord is right around the county median of between 600 and 700 cases per 100,000 over the last 14 days.
Sorry,
Okay.
Tom, it's refreshing. So give it a second.
we can scroll down a little
There we
bit
go.
more. Yeah. Okay. Our testing data, we're continuing to show really good output on our tests. If we can scroll down a little bit further, the number of tests per day, we just went past it, but the bar chart just above. I believe, yeah, new tests by collection day. And you can see there that our goal was to have 4,500 tests a day in the county, and we've been blowing way past that, up to about 9,000, close to 10,000 tests per day in some cases, which is exactly what we need to be doing. The county worked really hard to roll out this testing capacity, both through county sites and in partnership with our other hospitals and the other hospitals in the hospitals in the county and state partners, and that we're right where we need to be, actually, because we need that high testing volume in order to know that we're actually finding the cases and notifying people so that they can isolate and protect themselves and their families. Scroll down a little bit. Deaths were a total of 392 overall for the county. Unfortunately, we've seen increasing deaths coming through with the increased numbers recently. I would say the good news is our death rate compared to our number of cases is quite a bit lower than some other areas in the country, which is, I think, a good testament to our public health system and to our hospital systems in the jobs they're doing, as well as a good testament to our communities and what we've done to keep ourselves relatively safer. The other things I just want to mention in terms of this, maybe Kim, would be to go to the hospitals page. You know, one of the critical things that we're always really concerned about with respect to this surge is how are our hospitals doing? And you guys know it. You heard about it back in the springtime and in New York and in Massachusetts, what they were facing. And we've heard in recent weeks, the last couple months in recent weeks, what the LA area, Southern California is facing in the Central Valley, where ICU capacity is 0%, where hospitals they're running into crisis. In some cases, their oxygen systems are being overwhelmed, you know, and so part of the reason why we do the prevention we're doing, and while we try to stay at home and slow this thing down until we get vaccine, is so that we can keep our hospitals functioning safely. And I got to tell you that here in the Bay Area, we're doing pretty good. Our hospital numbers have been going up steadily for the last 2 months, and we're currently 261 with coronavirus in our hospitals. We've been up as high as close to 300 in the last few days. So the numbers have been increasing. The good news is that we're stretching, but we're not overstretched yet. Our hospitals still have capacity, and they still have a little bit of room to expand. If you look at our ICU capacity, scrolling down, actually, Kim, just stop there at that colorful graph. This is our overall hospital census in the county, and you can see we're getting into moderate surge levels at the hospital, the hospitalizations in the county. So that's concerning, and the hospitals are gearing up, but our ICUs still have some beds, and we still have plenty of ventilators available, and so that's good. So scrolling down, our current ICU capacity we have 10.7% capacity. This is according to the state numbers. I think overall we have about 158 ICU beds occupied and about 19 available currently. So they become more and more full, but we're still not to this quite the crisis stage, and so we're working really hard to keep those numbers where they are in terms of still having. Well, the key thing here is we got to make sure that if any of us have coronavirus, or if any of us have an automobile accident or a heart attack, that the hospitals have sufficient capacity to take care of us quickly and with top level of medical care. And so, that's critical that we maintain that. And that's been one of our key goals. I would say we're still doing pretty well, but it is more serious. All the more reason why we need to keep the prevention measures in place all around. Going down just a little bit more. These are you can see on this graph how while our ICUs are not yet totally full, the proportion of patients within the ICUs that are with coronavirus is now getting close to half. So we're really in a different situation than we saw earlier in the year or in the mid-year, where all the hospitals would have a few ICU patients, and right now, we're looking at 50% in the ICUs. Okay, if we can switch to the vaccine page. And then now we'll start talking about the good news. So if you stop at that number right there, vaccine doses administered so far, and you know that we just started. I think we're now in the 4th week, or maybe did we just start the 5th week, or we're
This
starting
is the 4th week.
This is the 4th week. We're just now in the 4th week of this program. Just 4 weeks ago, the first vaccine was being distributed. I remember. I don't remember the day, but it was on a Sunday when we saw the first shipments go out of the Pfizer factory and outside of Kalamazoo in Michigan. It's been a very, very short time, but we've scaled up this capacity to start getting things out. I'll tell you a little bit of uptakes on this, my outtakes on the story. Is we're working really hard. I got to say, honestly, that I think Contra Costa has done a fantastic job of rolling out the vaccine as quickly as possible in the quantities that we can get to the top priority folks, and that good progress and that good implementation infrastructure that we've developed is going to carry through as we start to move more volumes in the coming weeks and start to reach the general population. The reason why I've been able to do that is because in the earlier parts, one, we have a good health system, we have a good county government, we have a good county health services. But more than that, or part of that, early on in this pandemic, we really the county and our local hospital partners and our local clinic partners really started working very closely together to scale up the response to support skilled nursing facilities and long-term care facilities and assisted living, to scaled up for testing. And now we're using those same partnerships in those relationships and relationships and partnerships in the public sector as well to create the opportunities to get the vaccine out there. So it's going pretty well here. All across the country, you've heard how only 1/3 of the doses have actually gotten out into people's arms yet. I think we're doing a little bit better than that here in Contra Costa. We're struggling with some of the same things, but I think it's an optimistic picture. If we scroll down a little bit, we can see the distribution phases. And actually, Kim, if you could go to that more detail of the vaccine distribution phases. Yeah. And if we go down there, you can see right here, this is what we've been focusing on so far. This is phase 1A. And as you know, I mean, the simple answer for what's in phase 1A is it's all the healthcare workers in the county, because we need to make sure that those folks working on the front lines with people with coronavirus stay safe, but also that our health system stays functioning well. So this was part of the national priority, state priority, and we felt the same and carried it out just the same, that the healthcare workers were to be first, and also healthcare. All workers in long-term care facilities for the elderly and for disabled, and so and the residents as well. And so that has been the focus in the first 3 or 4 weeks, and we're a substantial way into this. Some people are starting to get their second doses already. There's a pharmacy partnership with Walgreens and CVS that's helping out with the skilled nursing facilities, as well as the county, addressing county and John Muir and other partners, Lifelong, also addressing those. So we're working through this tier, I think, fairly successfully. I'll give you some stats on that in a minute. Let me show you what's coming up after that, though. Once we get through that, we're going to be moving into phase 1B, estimated to be winter time. We're in the winter time, so this is going to be very soon. We can't say exactly when, because we don't have perfect projections or crystal ball on the supplies we're going to be getting in the coming weeks, but we're thinking we're going to be moving into this fairly soon. Phase 1B will be people over 75 and over, ages 75 and over, in the first tier. And then in the second tier of this phase, it'll be 65 to 74, as well as some frontline essential workers in congregate settings. And some of the essential workers will be in industries such as education, childcare, emergency services, and food and agriculture in the first tier. And then transportation, logistics, sheltering, residential sheltering facilities, manufacturing, and congregate settings such as jails and homeless as well. So this will be phase 1B, and we'll be moving into that, in the coming weeks.
Hey, Tom, can I just jump in about one
Yeah.
thing about that? One of the governor actually gave us some flexibility to be able to vaccinate some people in phase 1B with the goal that we not ever waste any vaccines. So if we come, it gives us flexibility to make sure that every vial of vaccine that we take out of the freezer in a day gets put in somebody's arm. So if there's nobody left in phase 1A to vaccinate in the location where they are, they can go ahead and vaccinate people in phase 1B. So it just allows for flexibility. Last thing we want to do is throw away the vaccine.
Absolutely. And what Kim says highlights another aspect of this, just so you kind of see how everything stacks up. The phase 1A, phase 1B, phase 1C, it won't be complete 100% and then move to the next. We're getting through a majority of the first doses in phase 1A, and while we're looking at starting phase 1B, and again, some flexibility to move into it to make sure we're not wasting capacity or doses. So there may be some outreach there. And as we get strongly into phase 1B, which is a lot of people, phase 1A is about 50,000 people in our county. Phase 1B is about 300,000 people in our county. So as we start to move through phase 1B, as we start to reach a majority of that population, then it'll probably be opened up to some extent to phase 1C as well. We can't say exactly when. All we can say is kind of this is the general order. Again, we don't have control of the supply coming to us, but we're expecting much greater supply in the coming weeks. Phase 1C, which would follow that, would be ages 50 to 64, and then younger adults 16 or older with high-risk medical conditions, as well as essential workers in other industries. And then after we get through all that, then it'll be opened up to anybody in the general population that wasn't covered above. So, and we do have an ethical and equitable vaccine allocations committee that is working with the local decisions within the federal and state frameworks for this to make sure that everything goes forward nicely. Okay, so there are, Colleen, do we have a few more minutes? Should I have a few more things I might say about vaccines, or I could just kind of open it up for questions?
Well, you do definitely have some more time for sure,
Okay.
But we do have a question that is, what is a high-risk medical condition considered? What is considered a high-risk medical condition?
It could be any number of things. I actually don't have a list in front of me, but certainly people that have immune suppressing conditions or are taking medicines for other conditions such as rheumatologic or GI conditions or cancer or transplant that result in suppressing their immune system are certainly in that group, as well as people with lung disease and heart disease and diabetes and a number of other illnesses.
And another question is, when will they know when the vaccine's available for that group? Like, for instance, if they're an older person, when will they know that they actually can get the vaccine, and where do they have to go to get it?
Sure. So let me go through a few other points that'll kind of answer that, and then maybe I'll answer more specific questions if it's not clear. Okay. All right.
Okay.
All right. So, I think one of the things I've kind of told you about the order that we're going in right now, we have first doses going to frontline health workers and nursing home residents and people that work in nursing homes and board and cares and so on and so forth. But we are looking at moving to phase 1B soon and starting to reach that additional 300,000 people, including a lot of people in the general community. And so we're really excited about that. There's no higher priority today in Contra Costa County for our health services or for the county government overall. And I think all of our municipal partners and fire and everybody else, there's no higher priority than immunizing our residents for COVID-19 as quickly, safely, and efficiently as we can imagine it. We hear the urgency in the public and we share it. We appreciate everybody's patience as we step through these first few weeks where the supplies are relatively low and stepping up our capacity, our infrastructure, so we're better able to deliver the higher volume of it in the coming month or two. We have delivered more than 30,000 doses already in the past 3 weeks. So I think that's really great. And we're making sure that nothing's going to get wasted. We're making sure that everything will be used within 2 weeks of when we get it. I think the governor has set the standard of within 10 days, and we'll be trying to reach that as well. I don't think we're going to have any problem with that. Every week we're receiving more vaccines from Pfizer and from Moderna. And so we get more and more, and we're trying to get even more. I want you to know that the vaccines that are approved for use in the U.S. are safe and effective, and they're the key for us moving to the point where we can reopen our community. So that's one thing I really haven't talked about, but we urge everyone to get vaccinated if they're eligible. Our ability to reopen businesses, schools, places of worship, and everything else in the community depends on the vaccine. We can get COVID-19 under control if we get 80% of the eligible population, which would be about 725,000 people in our county. 80% of the eligible population, if we get them to get the vaccine, that's going to protect all of us. So we all kind of need to do our part. I mean, I would argue from an individual selfish perspective, get it. But from your family's perspective, get it. From your community's perspective, get it. And from our overall shutting this thing down perspective and getting back to normal life, get it. Contra Costa, we do have 900,000 residents. We hope to vaccinate at least 80% within 6 months. So that's 725,000. To do that, we have to scale up to doing about 7,000 shots a day. That's just for the first doses, and that's not including second doses. So we're not there yet, but we are up to about 2,500 a day, and we haven't even really rolled it out to the individual medical practices and pharmacies that will be delivering it. So I think that we can see a path and a road to getting to that number so that we can get this done quickly and efficiently. We are working quickly and rapidly in partnership with our network, and that's our healthcare network partners, the big hospitals, the health system, Sutter, Kaiser, our FQ federally qualified health centers, Lifelong, La Clinica, as well as pharmacies. We actually have developed for instance, a partnership with Safeway and Rite Aid, so that they'll be able to give it in their pharmacies as well. We expect that essential workers and, as I said, people over 75 will be eligible coming up soon. I want to say more about that. Yeah, how will you know? So as we move into this next group, the phase 1B, which will include the over 75 population and essential workers and a number of groups, we actually envision that this will be delivered primarily through your medical practices, through your health system, through your health networks. That's not how we're not delivering it right now that way, because it's mostly being done through the hospitals to health center employees or through outreach to nursing homes. But as we open up to the general population, it will generally be delivered through your doctor's office, and so and maybe also through your pharmacy. Okay, so as we get to that point, we expect that your healthcare providers are going to be letting you know when it's time to sign up. We'll also have a lot of information on the county website when we open up to those phases. And we need to know that we will meet our goals if we all pitch in, including all of our healthcare partners, and we expect that we will. So as I mentioned, we have partnerships already working with the pharmacies and a lot of the clinics in the networks. And I also want to just mention a little bit about how this is distributed. In addition to, you may wonder how it's coming in, how it's being distributed, and so on and so forth. Just in general, the county is the hub for receiving most of the vaccines at this point. And we're receiving them and we're distributing them out to our partners, our hospital partners, and others for distribution. There's two other important ways that vaccines are coming into the community, though. And one is our big health systems in the county, like Kaiser and Sutter. They are getting distributions directly from the state, and they're sending those out to their hospitals in the region and in the area. So in addition to it coming in to Contra Costa, and then we would be distributing out to health practices, or Muir or San Ramon Valley. Kaiser and Sutter will be getting it through their central operations directly from the state. And then we also have this pharmacy partnership from the federal level, where CVS and Walgreens are sending teams out to the skilled nursing facilities and the long-term care facilities in order to vaccinate both the workers and the residents in those places. So it's through all these different methods that we're building the capacity and the networks to make this happen. Okay, and then yeah, I think that this is really, really good news. We just need to know that we need to support the vaccine effort. I hope you all will feel comfortable, but I'm here to answer questions. So me or your healthcare provider can hopefully answer your questions. This is a really good move. But in the meantime, until we get the majority of the population, vaccinated, we really still have to rely on social distancing, avoiding social gatherings, wearing masks, and getting tested if you're not feeling well, staying at home. All these things are really super important in order to keep us all safe in the meantime until we get to a better place.
Totally agree. Thank you so much, Dr. Warren. We did get a couple questions. So one of them was about reopening business, which you did cover. So I think you covered that one. Another one was how long will the vaccine last? How often do they need to get the vaccine?
Well, so we don't know for sure, but we do expect that the vaccine, the immune protection, the immunity that will be conveyed by the vaccine, we do expect that it'll be longer and more stronger and more durable than, for instance, the immunity that you get through being infected. Particularly if you had a mild infection or asymptomatic infection, we do think the vaccine is probably going to be stronger protective effect than that and lasting for longer. So we don't know yet, but we don't expect that we'll need to be like a 1 year sort of vaccine. In terms of what we do know about the vaccines that we have right now, Pfizer and the Moderna, I think you all know that it is 2 doses. The first dose is followed by a second dose at either 3 or 21 or 28 days, depending on the vaccine. We do know that the first dose of the vaccine does confer 80 to 90% effectiveness or protectiveness within a couple weeks of the first dose, 2 to 3 weeks of the first dose. So you get a majority of the benefit early on with the first dose, and I think the second dose makes it more complete and probably more durable. But it's a good vaccine.
That's great. Another question was, what type of side effects will I face?
I think that people have experienced side effects with this vaccine, not insignificant. I think that there are a number of vaccines out there that people get where you do typically have a local reaction or a short-term systemic reaction. The flu shot like that for some folks. The new shingle shot is a bit notorious for that. A lot of people have had sore arms and felt lousy for a day after the shingle shot. This is probably similar, although I have to say, my experience and the experience of folks that I know that have gotten the first dose haven't had very serious side effects. Very, very rarely people have allergic reactions, very, very rarely. But we've heard about, a few cases of that on the news and so on and so forth. Typically what people are finding is some soreness at the vaccine site and perhaps some feeling tiredness and fatigue, maybe body ache and that sort of thing. Not too bad though. I'm told that the second dose might be a little bit more intense than the first. So, we haven't heard a lot of people with local experience yet. So,
yeah. I actually had a nurse friend of mine who had the vaccine, and she said she had more energy after the second shot. And so it was kind of funny. But then her husband, who also works for the hospital, said that he was a little tired, but otherwise nothing. So she had more energy. He was tired. So
yeah. And I so. after my first dose, I definitely had some upper respiratory congestion. My ears were a little bit, funny for a day, but not too bad.
Yep. Okay. Does anybody here on
It looks like
Anybody else
Councilmember
have any
Hoffmeister has
questions?
a question, so.
Yeah.
Oh, Laura.
Hi there.
Hi.
Councilmember Hoffmeister here. Appreciated your presentation. A couple of questions that I've heard from constituents, and I keep referring them either to the county health department or to Karen Mitchoff, who serves as the ad hoc committee with the county health. And so I know her staff can often fetter some of these responses back to the constituents. The question, and you touched upon this, and I wasn't aware of this, but for those that are elderly, that are housebound, how do you plan to get vaccinations to them? What is the plan when they can't get in to see their primary caregiver? They don't drive. They're not going to go into a transportation vehicle or dial a ride. Our senior programs for those. And I was really disappointed to hear that you're going to rely upon, even for the 75 and older population, that go to your primary care physician and get it. And right now, I know how hard it is to get an appointment with my primary care physician. Even for my parents, I've failed on my appointments. I'm just dealing with theirs because they're both 95 and 86. So one is they have difficulty getting to the office because of the distance they have to travel with their walker and down the hallways and with the mask on, and they can't breathe very well. I was hoping to see a drive-through or some sort of area where we can bring seniors, not the mess that Florida had, but something a little bit staged and organized by appointments, or something that could be done in a more accessible manner, because it's going to be very hard. And all of the doctors have cut back the number of appointments they see per day for patient load in order to ensure that the offices have socially distancing. The patients aren't all piled up in the waiting room. You've all been there. It's like, what you get, 6 or 7 people in the waiting room that used to have about 25 or 30. So I'm trying to figure out how you're going to accomplish your goal if you're going to rely upon the primary care physician without having some sort of mass, inoculation, like the drive-through flu shots that Kaiser and the rest have in the county has. So I'm just trying to figure this out, because that was a shock to me, because now I've got to figure out, I may not be able to get them to get their shots when their time comes because of the accessibility being difficult. I'm sure I'm not the only one. I can drive them, but it's still a difficult, and they may not be able to access their primary care, because I've blown off their primary care physician because their office is just too hard to access for them. So we see the cardiologist, the pulmonary, and the oncologist.
Yeah, we just had a meeting with Kaiser today. And so let me just be clear. We'll be relying on those health systems to provide the vaccine, but it's not necessarily in the form of an appointment with their doctor. So Kaiser today has committed to starting some max vaccine clinics through Kaiser. So just because we're saying get it from your primary care physician doesn't. But the other thing I think to keep in mind.
What if you're PPO and you're not Kaiser?
So all of them will do it. So let me finish.
Okay.
For instance, John Muir Health right now is doing what we call a closed pod, which is a distribution point in Rossmore. So all of the healthcare providers are looking at how they can really do this in a much more accessible way that is not like going to your primary care physician. All of us are thinking about this completely differently. It's important to point out that the vaccine actually requires a 15-minute observation point after. So it's not like a flu vaccine where you can drive in, get the shot and drive out. And so there are some logistical considerations, and they require a vaccine, an appointment. The sheer number of appointments that we're making in all the different systems, just from a logistical perspective, it really does require an appointment. So I think that's really important to know, that while you will have to make an appointment and while you will be going to your primary care provider to get the vaccine, it's not like a doctor's visit. It will be a different kind of setup, and each system will do it a little differently. So it's really important that you stay in touch with your primary care provider to learn the information and the how-to, not necessarily because you need a doctor's appointment to go and get the vaccine.
No, I'm not saying a doctor's appointment. I don't want to go to the doctor's office to have the shot. Would the shot be administered someplace else?
Yeah, so that's what we're understanding, is that they all will be setting up these kind of max vaccine clinics that are outside of the regular doctor's office, yes.
Okay, and that's through the healthcare network systems you're talking about?
So like Kaiser will set up their own systems, John Muir Health will set up their own systems, Rite Aid and Safeway and Costco will set up their own systems. Everywhere that you can think of to get any sort of medical care will have a system that they put in place.
Okay, because you've got your physician group and you've got BASS too, who aren't part of the John Muir Health Network. So I'm just trying to figure out. So could I take them to CVS, which is where I get their flu shots.
So what is happening right now is that people are being assigned a locations, but all of this is still rolling out. So right now
Okay.
we're doing phase 1A, right?
Right.
And phase 1A is those healthcare workers and all those people that we
Yeah.
already talked about. And so when they sign up to get an appointment, we assign them a location. So we might say, okay, you, John Smith, who is an in-home service provider, you go to CVS and get yours, and you, Jane Smith, you go to CCRMC and get yours. And so
Okay.
that's how the system is working now. But as we roll out to bigger and bigger chunks of the population, I think, as Tom said, 1B is 300,000 people. Each system will have to communicate how they plan to address. As the county, we anticipate that we will vaccinate about a third of the population that is eligible. So that's about 300,000 people. The remaining 400,000, 500,000, 600,000 people will be vaccinated through the private healthcare systems. And so the way that they set that up, it's really very important that you stay in touch with them and really understand how their system will work and how to protect yourself. They're all very cognizant of the fact that these are people over the age of 85 that are getting vaccinated, and so it's over 75, and so it's concerning to them as well.
Yeah, no, I just was trying to understand more the logistics of, the time frame you had there and how to figure this out with all their other medical appointments. The other question I had that had been asked is, with the senior population, if you have an underlying condition of COPD or asthma or heart condition, is Pfizer or Moderna, I know they both have different side effects, is one maybe a better choice, or how does that work? Because the doctors don't know. I mean, they're not up to speed on it's county health, and some of these other people are following these logistics. So I'm just not sure, if there's a better outcome or better option for one over the other.
So we don't have any reason to suspect that one is better than the other. In terms of the Pfizer and the Moderna, they're actually the same technology. It's a new technology. Right. It's the mRNA vaccine. We're fortunate that it seems to work really, really well. Similar side effect profile, not substantial differences. There would be nothing that would be be strong enough data or information to suggest that one or the other is better for this or that group. We're treating them as being interchangeable, except for they're not actually interchangeable. If you get the first dose,
yes,
the first dose of the same one, but they have very, very similar profiles, different than the other ones that are out there, like the AstraZeneca, that came up from the UK, or then there's other ones coming down the pipeline in the United States, like Johnson & Johnson, for instance, and they all may be a little bit different. I don't know enough to say if one of those is going to be a better shot for any particular group. But right now, between the Pfizer and the Moderna, and they both just seem to be such good vaccines that I wouldn't hesitate to get them.
No, I just didn't know if one might be better with underlying conditions than another one. And it sounds like from what you know of the data, they seem to be the same. And have you guys just been issuing the Pfizer vaccine? Is that the allotment that the county got?
We've been doing both.
Oh, you've been doing both.
Yeah.
Okay.
Yeah.
And then the last question I have is, I heard somewhere along life's merry way, two things. One is, if you have Botox treatments, don't get the shot because it attacks your body and wherever your Botox is. It looks at that as a foreign invader. And then the other question I had was related to shingles, that people should not get this shot if they just had a shingles shot, that there's some sort of interaction and separation. I don't know if you have any information about that.
So the ideal, and CDC has put out guidance around that, because that's a very common situation. I've actually counseled a couple people in clinic on that as well. Should I get my Tdap and my shingle shot now if I might get the, and I think that the general guidance is that if you can separate the vaccines by 2 weeks, that's probably a good thing. Now, so for the Pfizer vaccine, if you're actually going to get it, the first shot at one, and then the second one 3 weeks later, you wouldn't be able to get a vaccine in between and have it be two weeks away from either one. So it might involve a little bit of logistics, but in general, I would say if someone's going for to the doctor this week and they might be offered the shingle shot, maybe go ahead and get it. And just figure that, it'll probably be at least 2 weeks before you get the coronavirus vaccine. So in the ideal 2-week separation, but it's not absolute. And I would not counsel giving up the opportunity to get the coronavirus shot at a certain time, just because you may have had a different vaccine 10 days before or 7 days before. I would still go ahead and get it if you have the opportunity to get it then, and you wouldn't have the opportunity until a couple weeks later. It's just a hypothetical. It's just a hypothetical at this point, cautionary, and maybe best to wait 2 weeks in between.
And then for other segments of our population, because I know you don't have to have regardless of documentation status, all this other stuff, the shots are free. But if you have to go through a primary care physician, you don't have one, what is the ability, how do you get information out and where would you go? Is that something still being developed by the county?
Well, I think that, and Kim may have more to say on this. I'll say up from the start that if you don't have a primary care doctor, get signed up for one. If you have insurance, you'll have a home network of some sort. Most people do. There's probably a few people out there that have health insurance and they're not tied to a certain network, but most people do. So be in contact with that network and try to get the answers from them, whether it's a PPO or whether it's Kaiser or a mirror provider network or something like that, or CCHP. And then while you're at it, get signed up for a primary care doc because it's important to have one.
Well, you didn't answer my question. There are people in our community, especially in Concord, that don't have any of that and will not sign up for any of that because they are hesitant about government operations. They still go and they'll do the drive-through free flu vaccines and all those other things. But since this isn't going to be distributed in that way, I'm concerned about a large segment of our population, especially the socioeconomic deprived areas that are highly congested or higher density areas that have kind of a higher level of outbreak already. What's seen to be a solution to treat them? Like you can go get the drive-through testing done and you can go down for a free test, but you can't get a free shot somewhere that's more accessible.
I think we will have free options available, and maybe Kim can speak to this more than I can, but definitely insurance status will not be a barrier to getting the coronavirus vaccine in the county, and I suspect we'll probably be working through both our federally qualified health center network partners such as Lifelong and La Clinica, as well as CCHP and Contra Costa Health Services to make sure that everybody is covered. And Kim,
I have my camera off because my internet is a little unstable, so apologies that I have my camera off. But so I think council member, the model that we've set up around testing, I think is a really great example of how we'll do this. Absolutely. So when we say that the county will be responsible for 1/3 of the vaccines that go out in the county, that's a huge part of the segment of the population that we're talking about. And we are doing, comprehensive outreach. One of the great things that has come out of the testing process is the development of partnerships and networks with our community-based organizations that are stronger than they have ever been. And we're really counting on them to help us get the information out and to help us understand when and where we need to be. So we have a series of mobile health clinics. We have a bus that's being allocated to us from the state. And all of these things are an effort to take the vaccine to where people are and not have the expectation that they come to us. The way that it's set up right now is really for, healthcare workers who have the opportunity to come to us. But when we go out into the broader community, it is very much about using our, 11 community-based clinics that are already out there serving these communities. It's about how do we set up these pods, these dispensing units throughout our community. It's about how do we use libraries, and fire stations is a big one. We are now activating all of the paramedics and EMTs in Contra Costa County to give vaccines, and so firehouses are a perfect place. As kind of an unusual place they might go. So we are really exploring and developing all this infrastructure as we go.
And I don't know if you guys have given it any thought in your brainstorming sessions and your planning sessions, but the one part, and I kind of mentioned at the beginning, those that are unable to get out of their home, the homebound, whether it's from a medical condition or just elderly that have no way to get out of their home, have you guys looked at developing an option where you would have some of your technicians be able to go to the home and give them the shot there?
So that's a harder thing because of the refrigeration needs of the vaccine and the expiration. So that's a harder thing. We're trying to figure out kind of how some of those logistical issues get worked out. But because the vaccine has to stay so cold, it really does. We can put it in a cooler and take it, but there's a very limited amount of time that it can be out of refrigeration and in the cooler. So that and the observation period are two big logistical issues that we don't have with a regular flu vaccine that we're working to overcome. But yes, great suggestions and absolutely looking at that.
Thank you.
Great information. Well, wonderful. It doesn't look like we have any. Laura asked some of the questions that some people were asking on YouTube, so thank you, Laura, for that, or Ms. Hoffmeister, I should say. But yeah, it's wonderful. And Dr. Warren, I really appreciate you being here to educate us and to help us. You actually answered quite a few of the questions I had, because I actually have a mom with dementia, and it's really nice to be able to know exactly what steps I need to take, and you really helped with that. So I so appreciate that. And for you being here, and Kim assisted you, of course. So I thank you.
Thank you, Tom.
Thank you.
Thank you so much.
Y'all take care.
So now we're going to pass this over to Laura so that she can share with us her wonderful information to talk to us about Concord. So I thank you very much, Laura, for being here.
Okay, well, thank you very much. And hello, everybody out there in Zoom land and on YouTube. Okay, couple things you might have heard or read about, and I think I talked about it before. The Coast Guard property off of Olivera Road is on the auction block by the Coast Guard. This is the old Victory Village and Quinlet Village there as you go down Olivera, across from Willow Pass Park and I guess the Little League fields or the Pixie Playland area. Right now, it's in an open auction process with the Coast Guard through the General Services Division of the Feds. And the current bid price is $35,800,000. The way the bidding works is every day at a certain time in the morning, I think it's like 8 o'clock Central Time, they post the latest highest bid, and the bids have to be placed in $200,000 increments. So this has been going on now for about 60 days, I think. The price was around 18 million and it's run up to 35.8 million. So every morning we get an update to see if there's been another bid submitted. And there seems to be about 5 or 6 active bidders and 3 that keep going back and forth. We don't know who they are. Nobody does. They're just given a bid number of 1, 2, 3, 4, 5, 6. And so they post, number 5 has the highest price right now at $35,800,000. So we keep monitoring that. That property does not have zoning or general plan on it. So whoever buys the property will need to come back to the city and submit a proposal, and it'll go through all the regular public hearing processes that the city would hold on any other type of development application, including environmental review, traffic studies, and so forth. The city is the rest of the Concord Naval Weapons Station, which I know the community out there is also interested in, is we have an ad hoc committee of the mayor and vice mayor that are working on master developer criteria process. It's how would we select a new master developer? What criteria would we want to look at? And so they've been working on that. And basically that criteria is more of the qualifications of a potential master developer. And so they're working on that document, and that will be brought back to the city council probably February at this time, end of February, it looks like, or more than likely early March is when we expect to hear back from our ad hoc committee. Again, they're just kind of proposing what would be the things we would want to look at in order to select a new master developer. Wanted to make sure the public, anybody who is a business person out there or is a nonprofit organization, The state has a grant program, and they extended the small business and nonprofit grant program to Wednesday of this week. And based upon your income, the business size, you can get grants from, I think it's from $5,000 to $50,000. If you read through the details of the package, it looks like some of these are forgivable. They have like a low interest rate they charge to it, but it looks like they're all discharged at the end of the day. So it's not quite a loan, it is a grant, even though they talk about it. But if you need information, you can contact the city offices. We can set you up with that. Karen Mitchoff's website, and I think our city website also has links to that on our city pages. We are monitoring, the state is back in session, the state Senate and legislature. And a couple of things that were of interest to people is the emergency eviction standards are looking at being extended by the state legislature at least through March 31st. That's one bill. There is another bill that looks like it's being fine-tuned, but it looks like it would extend it through the end of the calendar year. And so we're monitoring that. And it may be that these are done in two steps. It may be that the March 31st one might come through as emergency legislation and be enacted quite quickly, while the other bill extending it all the way to the end of the year may take a little bit longer time period and go through a longer process with the state legislature. City staff and our ad hoc committee working on the COVID small business grants at the city level. We don't have any more grant funds available from the state at the city level. We already dispensed all of those. The state legislature in the current budget from the governor, we're reviewing that because there appears there may be some additional money now for COVID responses. And we're trying to figure out if that also includes business components. Again, that's the governor's proposed budget. It still has to be approved by the state legislature. And that doesn't happen really until June, late May, because the governor will do a May revised. This is his preliminary budget right now. And we're also reviewing the recently passed federal COVID financing stimulus package to see if there's anything in there for small businesses as well and nonprofits. It appears small businesses talked about, it's, some 3,600 pages long. So we're going through and looking at that information. Wanted to let you know that tomorrow night we do have a city council meeting. It does start at 6:30, the public session. Of interest to you, we have a presentation from BART, who is going to discuss their transit-oriented development preliminary policies that they're looking at that would apply to the Concord BART station in downtown Concord, as well as the North Concord BART station. And one of the things that we're going to have a review of is what policies is BART looking at, and how does that interface with the city policies, and where are there differences, and what might we want to tell BART about those differences. And so that will be on tomorrow night's council meeting. And we wanted to let you know that we also have a code enforcement presentation also tomorrow night on the council meeting. And then we have launched a podcast that's done every couple of weeks, and it rotates between council members that you can download from the apps, your app store, through Spotify, SoundCloud, or Apple Podcast. It's called Concord Connected. So if you go to your favorite app store, Spotify, SoundCloud, or Apple Podcast, and look for Concord Connected, you will be able to sign up to receive that podcast. So there are different topics that are done every couple of weeks, hosted by a different council member. And as a matter of fact, this last one that was done a week ago, I think it was, that just rolled out, was the mayor, and he was actually talking to the county health about COVID and the vaccinations and some of the issues going on that you had a presentation on here this evening. The next one will be next Thursday, and our vice mayor will be hosting that podcast. And he's working with some of our downtown businesses to tell you about what Comfort Food Week is. And that's a element that we've had promoted in our community about focusing on our downtown, or not just our downtown, our city businesses that provide food, and kind of highlighting some of that program and what can be done there. On a sadder note, we had 2 people that have been involved in our community pass away. 3 people actually pass away this last week. You know, Florence Weiss was our downtown events coordinator. She's well and healthy, but unfortunately her husband did pass away due to COVID within the last week. And then we had our community affairs and government affairs liaison with PG&E. He also passed away from COVID about a week ago. And so we're sorry to have lost those 2 people. Florence had retired last December to Southern California. And the last person I want to make note of, sometimes you'll see trucking companies all over town, the gravel trucks or some of the tanker trucks, mostly some of the gravel trucks. There's a company called Royal Trucking. That's a long-time city business in town. It's off of Commerce Avenues. Their offices, but their yards out in North Concord. The owner and the person who started the business, Roy Corio, passed away too. He was 92 years old, I believe. And so he lived a long life, and no, he did not pass away from COVID. But again, some people in our community that have involved in our community that have passed away this last week that we have sent notices out and condolence cards out to those family members. And I think that's about it that I've got right off the top of my head. And like I said, be happy to answer any questions if there are any. And you can always email me at laura.hoffmeister@cityofconcord.org. laura.hoffmeister@cityofconcord.org. That's it.
Wonderful. Thank you, Laura. We did get one question from YouTube, which was, when will we start having the events back at Todos Santos?
Well, as you heard from the county health staff, the vaccination program that they have outlined, which is tentative still, it's going to depend upon the vaccines getting to them and all of the ramp up of the distribution. The last tier looks like summer and all through summer. So no concerts in May. We're likely not anticipating that we may have 4th of July again this year. And you got to remember, and one of the things the county health officer did not explain is, even if you get the shot, you get immunity against the virus. You can still be a carrier of the virus and infect somebody who has not been inoculated. So you got to remember, you can be an asymptomatic carrier. The shot is to ensure that you don't develop the symptoms and the infection to where you need to be hospitalized. So it's kind of like other protections that you get. You could still be somewhat asymptomatic and spread it. So that's why there's going to be masking after the people get shot, get their inoculations. You'll have masking and social distancing still established until we get to a certain percentage of the public being vaccinated. And that's not just within our county, because you could have people coming from another county that may not be at that level. So that's why I think we're just going to have to keep monitoring this. But right now, we're not planning for anything at the beginning of the season. Whether anything happens in fall will be determined, because it is a 2-step process in the shots, and they are talking about the fall being the last series of shots to go out. So that could be fall to early winter or late fall. So in reality, I would say the tree lighting may be the first thing that you see come on board next year in this early December, because everything else may be a little bit limited, because they are not going to allow people to be in mass groups probably to start with. As the shots roll out and more people are being vaccinated, it's more than likely that they'll open up, movie theaters and some indoor facilities with limited occupancy and socially distant separating, churches and religious institutions, gymnasiums, things of that nature. You could do outdoor things, but it'd have to be very separated and very sparsely attended. So it doesn't make economic sense for us to put into place those things until we know that we're basically at herd immunity, or as the county health said, at that 80% number, which looks like it's talking about late fall of this 2021 year. But things
Wonderful.
could change.
Thank you.
Things could change, and maybe we get a big rollout of inoculations a lot faster. If the federal government does take a different tack than they have in the past, things could accelerate. But right now, based upon what we've seen, that's kind of the lay of the landscape.
Okay, and then there was something. Okay, never mind. Okay, you answered the other question already. Okay, well, I do want to thank you very much for being here for sure. It's really good that you came on board and to see us and to share with us that great information. I thought that was wonderful. But again, everybody who wants to reach out to Laura, she's always available for us. I'm telling you, she's so good at being available for us, for sure.
And if you didn't take down my number, feel free to shoot an email or text to Colleen. She's got all my contact information. She can relay it or get me your contact. You know, that's not a problem.
Yep. Yeah. If you didn't get her information, definitely just go ahead and email chair@danastates.org, and I will be more than happy to share her information with you guys.
And if you go to the city's website, all of the council members' contact information is on the city's website as well.
Yeah, and it's also at danastates.org under city contacts. So we have you there too.
Right. And just so you know, if anybody, the next time we do this, and I'm not sure, Colleen, what your schedule is for how you're planning to structure these, but when you send it out, if you want to ask if there's particular questions or topics ahead of time that you can get, and then I can make sure I touch on things that's important to the Dena neighborhood area.
Yeah, please do. And yes, so we are going to have, I'll do this slide first and then I'll tell Laura when she's going to be here next. But just to let you know, we're going to be having a giveaway for gift cards to Cheese Zombie and Cinco de Mayo. So if you are on Zoom, you are already entered. If you are on YouTube and did not ask a question, you do need to say hi on the comment section. So go to the comment section and type in hi or hello or whatever you want to say so we know you're there. And then you will be in the drawing for the Cheese Zombie or Cinco de Mayo gift cards. So I want to bring that up. So our next neighborhood meeting is going to be on March 22nd. And Laura, can you be there?
Is that a Monday?
That is a Monday.
Yeah, sure. Yes. And so, like I said, if you want to reach out to the Dena email list or whatever and ask them if there's any topics or questions and get that to me ahead of time, make sure I touch on pertinent things that they have an interest in.
Right. So if you do have any questions, just email chair@danastates.org or danaboard@danastates.org, and I'll be giving you that email address in a few moments as well.
And if I can, I just want to touch on one other topic I totally forgot about was
sure, no problem.
Something that the city's been working on. I think there's an interest in the community. You know, we've talked a lot about homelessness and mental health issues out there, and how can we address those in a better way? We've been successful to connect with a group in the county that already existed. A lot of the cities did not know about this group. So we're working with the mental evaluation team that the county already has these folks on board. And we're going to try to get something going a little bit earlier. Our police department has been trained to know when to reach out to these people so that they can better assist and assess situations where we're called out to by law enforcement when it's really a mental health issue, and they can do the evaluation and work with the family or work with our law enforcement on getting them better directed to the proper resources. So we're excited about rolling that out, which is going to be one of the future things, and then also enhancing our core homeless outreach efforts as well with some additional funding to create a Concord core team that we're not shared with Walnut Creek and Pleasant Hill. So we're making progress in both those fronts, and we're still working collaboratively with the county on trying to figure out how to ramp up a larger mental health evaluation model. But we've been lucky to find some resources already existing within the county where we can start taking some of those steps forward. So hopefully in the next couple of months, we'll be able to have that kind of more ramped up as we go forward. So just wanted to share that with you, that we have made some good progress in those areas.
That's wonderful. And I'm glad you shared that. That was great. Great. That's one of the issues that's kind of close to my heart as well. Again, we're going to have a dumpster day. Yay! March 20th is our dumpster day. So definitely get your stuff ready to be dumped. And I do need volunteers to help watch dumpsters. I do have some great volunteers that already watch
You
a
said
lot of
what
the
day?
dumpsters.
You said May. You said
March
it says
20th.
August.
No, we have one
Oh,
on
you
March
got
20th,
two
the
of
very
them.
first
Okay.
one. Yeah,
Oh.
we get two. I
Lucky
worked
you.
hard on that one.
Yeah, great.
So we got March 20th, and then the Dana Estates Night Out is scheduled for June 23rd. It may be virtual again, and it sounds by what we heard tonight that it's a very good possibility it may be virtual again. But I will tell you that once we are let free, we will definitely hold something at Dana Plaza. It may not be the Dana Night Out, but we will hold something, even if it's in the winter. We will do something so we can all see each other again and have fun. But Dana Night Out is scheduled for June 23rd. Garage sale is scheduled for July 31st. And second dumpster day, yes, we do get that. Your Dana board was able to get two again this year for August 7th. And then, of course, you can see the neighborhood meeting, the Halloween contest, and the lighting contest. Make sure you keep an eye on your newsletters because our wonderful board is working on giving more events and more little things that we can do just to keep us connected. And of course, you can always check us out on danaestates.org. And of course, make sure you remember to donate to us. We are, of course, your Dana Estates Neighborhood Alliance to keep us going strong. You can support to us by sending us a letter at 3957 Beechwood Drive, or just drop it in the mailbox. It's fine. You can bring it over and drop it on. There's a little table out front. You can drop it there, ding the doorbell, and run if you want to. Or, of course, we are on Amazon Smile. Just look up Dana Estates. And you can buy things and still be donating to us. And I do thank everybody, by the way, at the holiday season who utilized Amazon Smile. We did do really well with that one, so I do thank you guys for that. So I'm going to give the countdown and make sure that we have nobody else that's in the drawing. Okay. We got a few people here. Let's see who we can get in here. So we have a Cheese Zombie gift card. It's a $30 Cheese Zombie gift card. Now, if you are a winner, I do need you to email me your address at share@danaestates.org so I can leave it on your front porch. I will let you know if you want to email me your phone number or your email. Well, you're going to email your email. So I will let you know when I'm going to be dropping it off. It will be tomorrow, probably in the afternoon when I get off work. So definitely email me at share@danaestates.org if you become a winner. So let's see who the first person is. First person is Shanti Fuller. Shanti, guess what? You won. You get Cheese Zombies. And by the way, Shanti was actually our first prize in our holiday lighting contest for traditional. So she's like a second winner here. It's pretty cool. Okay. And for Cinco de Mayo, which is $20 at Cinco de Mayo. And that is going to be Sarah Zeppa. So Sarah, if you could email me, you get Cinco. So those are our two winners. I congratulate you guys. And I do want to say, just real quickly, that Dana Plaza is so important to us because we need them as much as they need us. Seriously. They are extremely important to us. So if every single one of us in Dana Estates visits one of the organizations at Dana Plaza once a week, that would help them out tremendously. Of course, you want to visit all the organizations in Concord, all the businesses, the small businesses especially, like Buttercup, Lazy Dog even. But Dana Plaza, if you're financially able, visit them. Mann's, Pizza Pie, all of the organizations in there because, again, an empty store is not good for us. So we want to keep them up and running. And I know they're hurting just like a lot of people are hurting. So if you financially are able, visit one of the locations once a week. Okay. I do want to thank you all for being here, all of you people that are out there on the YouTube channel. I'm so appreciative of you guys, and we will see you again in a couple months. So I thank you guys, and I thank you, Laura and Dr. Warren, for being here, and our wonderful Dana board. I love you guys very much, and glad you guys are here too. So I thank you, and I hope you guys all have a pleasant, wonderful, and healthy rest of your week. Bye-bye.